So before we start, I just wonder, I have 20 minutes, but don't worry, my slides only 10 pages. May I know, to the audience, how many healthcare professionals here? Oh, my. Alright. How about students? Okay. Is there anyone from the NGOs? Public? Public? Smokers? Okay. Alright, today I was given the topic, and the topic given to me is to control health outcomes. Talking about clinical evidence supporting policy action. A topic which is not easy to deliver, but I believe that I would change it a bit because I'm an epidemiologist, so I try to speak in terms of clinical epic kind of relationship with policy, inshallah. So I will be talking about a few things. First, very important information with regard to the history, how people recognize smoking, and we actually, when they started to realize that smoking is dangerous, it's already 50 years late. And then we will talking about progression of evidence from how people start to recognize that smoking is dangerous. And then we talk about the policy itself, how the policy evolved over time, and then the impact of those policies. And lastly, I will talk a bit about the new disruptor called vaping. Smoking has entered the world in 1900s, but only in 1950s people start to really document and publish their concern with regard to the safety of cigarette smoking. Those days, if you even watch the old classics in Western movies, black and white, everybody smoke. Male, female, and then if they show bars, especially in the bar, it's always hazy, smokes everywhere. Because those days people just smoke. So everybody smokes, children even smoke, but in television you don't see that much, but the reality is that everybody smoke. Why is it very late? In 1950s, actually started, the one that really interests me is when Ernst Winder, a medical student, who did his elective in New York Hospital in 1950. So he basically, what his elective is basically looking at those who died because of lung cancer. Those days, people believe that the cause of lung cancer is due to environmental exhaust, smoke coming from the mobile vehicle, because this is the beginning of the engine car. But then he realized that it may be caused by smoking. So he, among the first that invented phase control study design. So together with his supervisor, Rahman in New York, published a paper in JAMA that required numerous number of reviewers. So apa? Even Graham himself smoker and died of lung cancer. People smoke, and something like this, suddenly people come to see you and say, you makan nasi, you dapat cancer mulut. Kita beratus tahun makan nasi, mana ada? For example. So people do not believe, even the physicians. Meanwhile, in UK, Richard Dole and Austin Radford Hill, who is famous for the Hill criteria, the 9 guidelines, also study the same thing. They also publish, starting to publish the evidence. Why is it very late, 50 years delay? One, because the industry denial. Because for more than 50 years, this is lucrative, this is an addiction. So, industry. So they keep on denying that cigarette smoking causing harm. And then medical misconception. As I mentioned just now, even doctors die because of lung cancers. Initially, the studies done even prior to 1950s, but they tried to discover the environmental factor rather than the cigarette itself. And long latency. When you smoke cigarette, the effect is not immediate. The serious effect is not immediate. Normally, what, 10, 20 years delay documented when you start smoking is delayed. And then misplaced focus. Earlier study, I mentioned about Richard Doe. They studied about environmental factor rather than the smoking itself. And then evidence started to surface. Actually, there are few evidences coming from the German scientists, physicians, the association about lung cancer initially, very distant association. And then 1950 started when Richard Dole, Austin Bedford Hill published a paper in BMJ, Winder Graham published in JAMA. So this started to provide evidence. And after 1960s, more and more papers start to coming about the danger of cigarette. In 1964, it's very important. People say that this is the hallmark paper with regard to the danger of cigarette smoking in 1964. And coincidentally, Hill himself published the 9 criteria in 1965. And this is the progressions of disease. This is progressions of clinical outcomes of smoking. In 1920s, and then people talk about like first major analysis showing smokers have shorter lifespan. They started to discover that those who smoke more die faster. Landmark studies, as I mentioned about these two groups from US and also UK. And then 1954, also important British doctor study. And 1964, I mentioned just now, this is very important study that declares smoking is cause of lung cancer in men. So the causality between smoking and lung cancer started seriously in 1960s. And then 1980s, more and more studies done. Now not only lung, they are also affecting so many parts of our body. And currently we are also studying about, now I think we have to shift, not only about cigarette smoking, but about vaping as well. The study on e-cigarette is very few done. So I would be able, I believe we can divide in terms of the evolution of policy into four. One is before 1950s. There are certain people who believe that there's dangers, but those days, basically, is the era of ignorance. It is harmless. Smoking is harmless, just like makan nasi. 60s to 80s, the era of warning. It might be bad. Maybe. Kalau tengok, if you Google for photos about warning, those days, cigarette may cause harm. If you Google now, you can see so many Google image. Cigarette may cause harm. Those days. 90s to 2000, the era of restriction. Don't hurt others. If you are a smoker, don't hurt others. So now the tone start to increase. But since 2003, especially those who know FCDC, this conference, they should know better. 2007-8 in Malaysia, the era of global regulation. We must stop this. And the effect of this policy is the one that drives the prevalence of smoking going down very sharp after 2000. And then the health impact only come 20 years later. When the prevalence going down, then only you can see the health effect. The incidence of COPD, any lung diseases, and lung cancer started to reduce. So if now we are talking about the association between the policy and also the impact, so I will be using the M-Power framework. If you're looking at monitor, this is very important. We must continue to monitor the prevalence of disease. In Malaysia, the prevalence has been reduced from 23% to 17%. Last study was 17%. So we are hoping it's going to go lower. I'm not sure because now we have also vaping coming into the picture. So everything now is not, we are doing very well, and suddenly they realize we have to, because the policy is doing very well, so the industry shift in our the addiction start from cigarette to become e-cigarette. And about protect, about smoke-free law, This is where we normalize smoke-free environment. So it covers, this is the benefit of it. You're talking about 22.6 billion people from 79 countries. This is among others that easy to be done to protect others from. Remember I told you about the era. So this is actually the old style, the old policy. So many countries adopt this. Don't cause harm to others. If you're smoker, don't cause harm to others. So this is where the protect is. Offer cessation. This is the least adopted measure. Least adopted measure. Not many countries, not many institutions offer cessation clinic, quit smoking clinics. Not many countries. And about warning, this is the most successful growth. Print in the graphics, warnings, and in the cigarette. And then enforcement. So there are countries also enforce this, but I would like to mention about the tax. Among all the 6 measures, raise the tax is the most effective measure for tobacco control. Because if you raise the price of a cigarette, the prevalence will be reduced in 5 to 10 years. So every 1% will reduce 0.5% prevalence. Every 1% increase from the retail price will reduce the prevalence from 0.5 to 0.6%. So Malaysia has not been reviewed the price for more than about 10 years, I believe. So the last seminar we had a few weeks ago, 2 weeks ago, the recommendation is to follow WHO 75% for the retail price. We are nowhere near that suggestion. There are many papers talking about the impact, studying policy, and also clinical outcome. If we look into, for example, like if you look, I just pick one paper. They are looking into the changes after introducing the component, the measures of empower. RIP is about race, about tax, relative income. What? Relative income? Percentage, huh? But this is about tax, about ability, affordability of a cigarette. So if the tax is high, RIP will be low. So how effective is tax? And then PWP. So this is a typo there, less than 50 years old. So this is the relative change among the men, among the women, and this is overall change. You can see that the highest here, you can see 2.2, reduction of relative change. This is about warning. That's how I mentioned, effectiveness. And then another one is 2.1, and this one here is about, again, warning in different age group, also about enforcement. Here also warning. So warning, as mentioned in the previous slide, warning is among important change in terms of the prevalence of the habit now. So in terms of the impact, you can see that if we apply, not many studies are able to do this because this is not an easy study. Something you do in general to the entire country, and then you want to relate that causality with the overall health of the country. It's not easy. So this kind of research is very difficult to be done, and they require a lot of assumptions. In terms of statistics, it's very tough to ascertain the association. But we need people to continue producing such papers so that it will now convince the government that the policy works. With regard to protect or smoke-free law, it shows that there are immediate health benefit and also long-term health benefit. Immediate 12 to 70% reduction in heart attack hospitalization within 12 months. And they try to relate smoke-free law. How about the long-term effect? If the percentage goes high up to 46% lower risk of incident for cardiovascular disease. Again, but then you can see here, it took 20 years after we don't introduce those policies. Only we start to see the effect. 20 years. If we increase the tax, immediate drop in youth smoking initiation and overall consumption. Everything is about money. But remember, raising the tax is not, you cannot do this alone. One of the siblings of raising tax, the complication is what? Anyone? Illicit cigarette. So we need, kalau Ministry of MMF increase the tax, we need immigration to come in. Okay. Those are very important. And then warning, if we continue to raise, so we can see that we can avert 3.5 million deaths globally over time. Traffic level, double quick attempt among adolescents and adults, higher awareness of specific risks. Okay, offer, this is again I mentioned just now, not many countries, something that I believe Ministry of Health is working very hard about this. I believe we are very strong advocates of cessation clinics. So these two double higher success rate for individuals attempting to quit. If we have a systematic way to assist smokers to quit smoking, reduce the risk of recurrent heart failure if we are able to do that. And then, I'm almost complete. After all the success and progress, here comes e-cigarette. 2012, 2013, this is a gateway reversal. And impact on M and E especially, nicotine use rise again. Not, they started by saying, don't have to quit, switch. But in reality, what happened we are seeing now? Dual use. They don't stop, now they take both. In Europe, it's around 40% dual user. In Korea, it's around 85% dual users. In Malaysia, even we try to get the data, but it's not, we don't really have a solid data. In 2016, our team did the study. There is a percentage, but we don't really study that during that time. So now, this is Bubble Protect, somehow e-cigarette becomes so rampant because we try to avoid people from smoke in the public area, but vaping somehow people can accept. So those are the things that very scary. So in summary, it took us 50 years just to realize the danger of cigarette and evidence support policy evolution and their good impact to health outcome. But please, we are now facing e-cigarette and do not allow another 50 years before we discover the harm of e-cigarette. That's all from me. Thank you very much.